So at this point we've got a wire across. It's always good to do a full lateral view just to make sure that we haven't gone into a spinal collateral as you go up into the spine. It's very easy to get off piece. This patient is less likely because actually the veins above the groin are normal, but there is a possibility that we can wander off piece into a collateral as we're crossing through those paths. So we do a full lateral here. And I've got the 9 French sheath ready if you want to come up with that. And we're going to exchange now for a 9 French sheath from the 4 French sheath we've used while we're crossing.
Yeah, just take a single shot there. Good, thanks. Back to AP.
So that lateral view is confirmed that we're anterior to the spine, and that's what you want to check, that you've not gone through the spinal canal. So we've taken out the 4 French sheath, changed for a 9 French sheath, and now we'll do an IVUS run. Okay, so as we're going up with the IVUS, we're already kind of getting an idea that we're in the right channel, which we are all the way up. And one of the clues to that is that the artery sat next to the vein all the way through as we go up into the IVC, which we're in now. So if we can press record, please. Okay, so as we come down, we're into the common iliac vein, which looks relatively normal. Just screen while we're doing this. We can see the artery adjacent to the vein all the way down. Now we're starting to come into areas where we're seeing trabeculations and some scarring in the external iliac vein. We come across into the common femoral, which we can see is heavily scarred. And then we're coming below the scar tissue into a more normal segment of common femoral vein. And now we're in the femoral vein. Okay, press stop for me. No, it's not great. And just press live.
Can you just show us the lesser trochanter on the right side, please?
Yeah, that's it. So one of the things we're noticing on this case is that the inflow doesn't look particularly great. There's not a clear landing zone for the stent. Come down a bit further and a bit further out. Yeah, that's the one. Okay. So we're going to go in with the IVUS now. And the lesser trochanter on the X-ray is a very good landmark for where the profunda is going to come in. So as we come up to it, you can see the profunda coming in at that level there, but it's a pretty poor inflow vessel, and we come into a very heavily diseased, there's a branch coming in there, isn't there? Yeah, that's the collateral coming out. That's that big collateral that we kept going into, sitting over there, and that is probably profunda that's just gone off there. So there is, yeah, you can kind of, there, we're sitting on a profunda, yeah. So that's kind of okay, but it's, so there is a potential landing space for the stent on this, but it's very tenuous. It's a couple of millimeters long. So we'll balloon it up and see what we've got at the end of that. So what we're going to go for now is a 14 Atlas balloon, please.